To get someone who has your knowledge and expertise on a microphone to say what they genuinely think is very difficult.
I'm always very honest.
For women right now who are trying to conceive, fighting nausea, preparing for labor.
The hot topic of breastfeeding versus bottle feeding. You're seeing 90% of one gender.
What do you just think about the science behind that?
I mean, I think that is possible. Listen, and even to the point of really getting into the role of like splashing some on my scrub top to make it seem like I leaked.
What's your take on vaccinations post-birth? We're getting into the hot topics today.
Yeah.
Bound to offend somebody.
The biggest thing that I can say with that is
this is the Water Your Garden podcast. I'm Sarah Michaels. This episode is all about you, your chance to water your own garden, pour into your own life, and grow. Welcome to Water Your Garden. I am about to jump out of the seat with excitement for this week's episode because it is just that good. We have Rhonda Sobh with us this week, and we had to make ourselves stop talking before this recording because there are just so many juicy things that we are getting into. Rhonda has so many interesting and incredible stories from her work as a labor and delivery nurse, midwife, and now the owner of the expanding pregnancy bar, which is where we are right now, her OG location in Birmingham, Michigan. If you have any questions about being pregnant, giving birth, choices when it comes to your newborn baby, this is the episode for you. Rhonda, welcome to the show.
Thank you for having me, Sarah. I'm so excited to be here.
I'm so excited. This is just like, I'm geeking out over everything we were talking about. So we talked about how you're an expert in labor and delivery, all things babies. Mm-hmm. I want to start at the beginning.
Perfect.
How did you get involved in this world?
Yeah, good question. I feel like when it came down to career, I had it all planned out from high school. I thought I was going to become a dentist, and that was the career path I was going to take. I ended up pivoting, and I did things a little bit backwards. I had a bachelor's already in pre-med, and that's what I needed to go to dental school. I ended up doing an accelerated nursing program that's only 12 months. It's meant for people that already have a degree, and so got that over with, and I was super scared while I was in the program because I didn't like any of the clinical rotations. We go through like your basic med surg, pediatrics, ER, and I was getting towards the end of the program and I was like, nothing's clicking with me. I don't like this. And so I thought I had made the wrong career choice. I get to labor and delivery and I fell in love with it my first shift. It felt like my calling and everything made sense as to how I ended up there. And I wasted no time. Immediately, I knew I wanted to further my education. Wasn't sure what program it was going to be, but I looked into applying to a midwife program while I was still in nursing school. So I found, Michigan had two programs. I applied to Wayne State, and I had somebody from the admissions team contact me saying, I was a little confused by your application. Are you graduated? Are you still in school? What's going on? And so I had to explain to her, I'm still in school, but I'm getting ready to graduate. And I got a full interview. Everything went really good. The admissions director contacted me back and said, listen, I'm accepting you with 4 contingencies. And I was like, give them to me. I'll get them done. She said, you have to graduate with a 3.5 GPA or higher. And I was like, easy. You have to pass your NCLEX. And then you have to get a labor and delivery job. And then I can't even remember the 4th one, but basically did all that. I graduated. Yeah. And the 4th one was to graduate. And so did all that. Then I am getting towards the start date of my program and I can't find a labor and delivery job anywhere that's going to hire me straight out of school. Because a lot of times before you get to labor and delivery, you have to work on another unit beforehand because it's a specialty unit.
Right.
I ended up going to every single labor and delivery unit in Metro Detroit with donuts and going straight to the unit, got into the hospital. Oh, yeah. Got in there and a lot of times they won't even let you get past the doors. I would say, I'm here visiting. Yeah, I'm here to visit my sister that just gave birth. Got in and was just like, I need to speak to the manager. And so I got my foot in the door, got a job at Providence Southfield, and then started my program.
Wow.
Yeah. So I had to do the labor and delivery job throughout the course of the midwife program.
Okay.
So I was doing I was a nurse while I was going to school to become a nurse midwife.
That's so interesting because I don't know too much about the field, but I think about them as very different things. But I also think it's such a superpower that you have experience in both, because right now I feel like for a lot of women that are pregnant, they look at it almost as two different avenues. So the fact that you have had a hand in both, what was that experience like for you?
Yeah. So you're right. They are a little different because it also is the autonomy that you get with it. And so as a nurse midwife, you're able to make decisions. You're delivering the baby. You're not necessarily at the bedside as much. And you're in charge. You obviously have an OB to refer to that's working with you to go to questions, or they're overlooking you, but you're making the calls in that room. And so to one day being a nurse, and then in the evening, I'm making the calls while going through school because I'm in clinicals. It was being able to have the ability to turn that on and turn that off because I was playing two different roles. It was challenging, but I feel like it made me a stronger labor and delivery nurse, and then also made me a better midwife because I had such great bedside experience. So I was spending a lot of time in rooms with patients and being a part of the labor process and not just coming at the end when it was time to deliver a baby.
What is the difference between a labor and delivery nurse and a midwife?
Okay. So everyone kind of asks, like, what role does everybody play in the room? And I'm going to break it down for you. A labor and delivery nurse is there to be your nurse throughout the birth process for you. Usually it's a 1-to-1 ratio. They are at the bedside. They're charting throughout the whole course of your labor. They're doing position changes with you. They're there to be great support. But what people will hire for extra support, because your nurse doesn't stay in the room with you the whole time, they hire a doula, which plays as a birth support throughout the labor. They're there to support you, also do more position changes, get the baby to spin while you're in labor, be there for support for even your husband, and then be there to be your advocate. And then you have your significant other who's usually present in the room. And then for the provider, it's either a midwife or an OB. And they are very comparable. A midwife is there to have more of a low risk, non-intervention birth. And doesn't mean that they can't do interventions, but we really focus and work with the low risk population. An OB can also take care of low risk patients, but they are there to take care of high risk patients and also perform C-sections.
I see.
So OBs and midwives are very comparable, but the midwife or doctor is going to be the one to deliver the baby, and the nurse is there to assist in the delivery for the midwife or doctor.
So is it really for the OB and midwife? I'm guessing there's a difference in degree and medical training, but is it also, if you decide you want to be a midwife, is that also you saying, I want to be an advocate for a natural vaginal birth?
Yes.
Okay.
And the word midwife, the Latin root is with woman. And so in general, typically a midwife is always going to be the one to spend more time with patients throughout the course of the pregnancy and be there to be their biggest advocate as well. And yes, to promote for vaginal delivery.
Okay. So you have this incredible hybrid of experience, labor and delivery and midwife, and then you start to make social media videos. Tell us about this.
Yeah. So after I graduated, I forced myself into a job after nursing school. I kind of did the same when I became a midwife. I worked at the place that I had my clinical rotations with when I was in school. So it was a private practice. And when you work private practice as a midwife, you kind of split your time between the office where you're seeing patients throughout the day there and then the hospital. So it's full scope. I really loved doing the hospital part. And so even though I worked at a private practice, I was mostly in the hospital and I was doing 24-hour shifts there.
Wow.
Yeah.
More power to you.
Yeah. It was great. And I loved it so much. But I also wanted to have fun while I was doing it. You know, you're these shifts are so long and they can be very lonely. You have a call room and it becomes like a second home. And so I definitely revamped this room up and put things there that I really loved and used every day. And then used my social media to create a community. And then it just kept growing and more followers were on there. And then they were a part of these shifts with me.
So you were vlogging.
Mm-hmm.
Okay.
Yeah.
That's so interesting. I would love to follow you. Was this primarily Instagram, TikTok?
Instagram.
Okay.
Yes.
So you're vlogging these 24-hour shifts, and during these shifts, are you helping to deliver babies, I'm guessing?
Yes. So at the hospital, I did triage, which is kind of like the ER for pregnant women. And then they were for my patients that would go to the private clinic. And then I would do births. And then I first assisted C-sections as well. So I worked in the OR, in the operating room.
Wow.
Yeah. It was a time.
This is also just like the dream page to follow if you are pregnant.
Yeah.
You start creating all of this. You have your social media following. Now we know that you are the owner of the pregnancy bar in Birmingham. How did all of that transition begin for you?
Yeah. So pregnancy bar existed when I became a midwife. It started off super small though. I was just doing ultrasounds at the time and then created this Instagram page that had the name The Pregnancy Bar on there.
How in the world? So you out of college were looking into the midwifery. Is that correct? Midwifery, labor and delivery nurse, and you started the pregnancy bar?
Yeah.
That's crazy. Okay. So you're just an animal getting after it.
Oh, yeah. I don't even know what animal, but I'm one of them.
No, I love it. Like, that's really my type of girl. I love the ambition in that. So you had the pregnancy bar going the whole time.
Yeah.
But it looks like you really started to lean more into the pregnancy bar.
Yes. And I was growing it slowly because I had such a great job at the hospital. And I feel like that really took the pressure off. Like, the business has to perform. I have to see X amount of patients. It started off really slow and the business hours here were wild. There were times I was doing ultrasounds at 11 o'clock at night and people were trotting in here with their husbands because there was no set hours because my days were just all over the place.
Right.
And so I think that's the beauty of the business though. There was so much background and I have OG followers that followed this page from day one, and they have just like recently got on there to tell me it is so inspiring to watch all your dreams come true and to watch what transpired to the business because it started off with vlogging and just doing ultrasounds. And I wasn't even in this facility that we're here today. I was in a little Sola suite in West Bloomfield. And so it was like month-to-month rent. There was no commitment. It wasn't even designed or anything. But it's where I got to start the business slowly and smartly because
and probably affordable.
Right, because I self-funded this business. And so it took a lot of risk and it was like less risk, more fun.
I love that.
So there was no pressure behind it from the beginning. And it was very authentic and genuine when I first started it. And the two really went hand in hand looking back at it. I had built connections with all these women online, and then it made them want to meet me in person. And so if they weren't they were making appointments with me at the OB office if I was ever there. And then if they were pregnant, they were coming to meet me over here.
Yeah.
And so the business kind of grew from the social media.
Okay. When did you decide, though, that you wanted to leave the hospital setting and completely dive into the pregnancy bar?
I never wanted to.
Really?
Yeah. Basically had to end up making a decision it got to a point where it was that or it was here.
Because you just had so much going on.
So much. And it ended up, because it was never the plan to leave, it ended up coming down to a week of me having to make a decision. It was just like a really bad week. And like looking back, it was really just God forcing me out and making a decision for me. Because I didn't have any plans to leave. It was so abrupt. And God just made a plan for me and made the decision for me.
I always say you have to pay attention when things are getting really hard or you feel like doors keep closing or you're being forced out of something because Like my whole story is I never planned on leaving news. It was my whole life, my whole identity. I was so gun-ho, and a couple things happened in a row that just made me so miserable that it forced my hand to leave. And now in retrospect, so similarly, I'm like, thank God I left. I really feel like God shows you where he wants you to go sometimes by making those difficult situations. Okay.
Yeah,
So
you gave me goosebumps saying that because
no, I believe it. I think that's how life works a lot of times.
really does. And you said something right now that I actually have an exact video of. Looked back, I had something pop up on memories, and I was in the hospital in my call room, the second home. And I had said in the video that I could never imagine myself doing anything else, which like leaving the hospital.
Yeah.
And I said I would never do it because I would have an identity crisis.
Yes.
And
Yeah.
it ended up happening.
Yeah. No, I fully relate. That's so similar, so parallel to what I went through. But you open the pregnancy bar and you guys just take off. I follow you. You have so many services. It really is like a little heaven for a woman who is trying to conceive, pregnant, going through the process. Talk to us about all the cool things that you guys do here.
Yeah. So we obviously do the ultrasounds. That's what the business started with. And we have two different types. We have a 2D and we have like a 3D, 4D, which is super fun. You get to see all the facial features with that. That's like
wild.
a third trimester ultrasound. We do gender determination as early as 6 weeks.
That's crazy.
With next day results.
Wow.
And then we have a chiropractor that works here, massage therapists, prenatal yoga, prenatal Pilates, IV therapy, and our IVs are all curated based off of common pregnancy symptoms. And so when designing these IVs, I really sat down and used my background of being a midwife, of thinking of what were all of the things that people would complain about throughout the pregnancy, or what did I see patients come into triage for so I could prevent these hospital visits from happening. And so I curated the IV menu based off of common pregnancy symptoms.
So smart.
Yeah. And then we do lots of education. So we do the CPR class, we do birthing classes throughout the month. We offer privates for both of those. And then a few months ago, I started the doula agency, which is super busy and great, and lots of work came behind building that. So we offer labor doulas and postpartum doulas that are also referred to as night nurses.
Incredible. Okay, so it's really everything that you would want. The IV specifically, I'm very curious about. I've never heard of this. I'm about to be 26 weeks pregnant. Talk to me about the IVs. Also, by the way, if you're watching this interview, we're sitting in the IV room.
Yes.
It's beautiful. It's so cozy, so comfortable. What are the IVs beneficial for?
Yeah. So one of the most common pregnancy symptoms is dehydration, because it is so hard to either A, drink water in pregnancy, or B, a lot of times your body is depleted of water. And so we have hydration IVs that will help get you replenished with fluids. And then our next popular one is our nausea vomiting IV.
I wish I had known about this in my first trimester.
Yeah.
How much does this help? For me, my first trimester was, the nausea was insufferable.
Yeah.
So talk to me about what you hear from women when they get this IV.
Yeah. So immediately they're like, I don't know if this is placebo, but I'm feeling better already.
Incredible.
And the reason being is because the fluids are working their magic as it's running, because when you are nauseous and you are vomiting, you're so dehydrated.
Yeah.
And so it makes the nausea even worse.
Well, I had days where I couldn't, like Connor was with me. I remember this so transparently, so clearly in my head. I could not drink water and I was like crying. I was in so much pain. And he would say, you're in this pain because you're dehydrated. We would get the electrolyte packets and I would have a couple sips and puke it up. So I feel like these IVs would be a game changer for that.
Right. And it's a different route of administration. So those fluids are going straight into your vein and hydrating your body versus it passing through your GI system, and you're getting the full liter straight into your vein. And so that's why right away you start to feel better from that. Then the vitamins that are in there are meant to do different things. So, for example, we have the B6 in there, and I know a lot of times women are referred to get that in their first trimester because it does help with nausea.
Yeah, it helped me a lot.
But the IV version works way better than the oral version because with an oral supplement, you're only getting a fraction of that vitamin because it does pass through your GI system. And so you're not getting the full supplement. With the IV, it goes straight into your vein and you're getting 100% of that vitamin.
Absolutely.
Yeah.
So if a woman is really struggling with nausea, how often would you recommend that they seek out one of these IVs?
Yeah. So we have a lot of times where patients are coming in once a week for them. They're safe to get once a week. And we have packages that we created so that way people are able to do something like that because most women just have the nausea in the first trimester. And then you have 6 weeks for free in the beginning of the pregnancy because 0 to 6 weeks, you're not really having any symptoms.
Oh, yeah. I was exactly 6 weeks and 1 day when all of the nausea
They just
popped up out
overnight.
of nowhere. Exactly.
And so realistically, you're looking at about 6 to 8 weeks of maybe those harsh symptoms like the nausea.
Yeah, absolutely.
And so a lot of times it just gets people through the week. And then also you're giving your body what it's missing. And so the fluids are super important.
Oh, I wish I had known about that.
Yeah. Well, next pregnancy. But I hope you don't have nausea and you don't even need it.
Thank you. All the women in my family get it really, really bad. So we'll see.
Yeah.
We have the knowledge now. You also talked about doulas. Doulas are such a hot topic right now. There's so many people who say you have to have a doula, other people who say you don't need to have one. What are the top benefits, in your opinion, of having a doula?
Yes. So the amazing thing about doulas is there's evidence-based practice to say a few things about them. They decrease your risk of needing a C-section. They shorten the duration of your labor. Moms have better outcomes. And you are actually less likely to develop postpartum depression. And so
Wow.
There's so many great benefits to having a doula. But what I tell people is nowadays, for the most part, there's always uncertainties that day. So you have your OB, you're not sure who's going to deliver you because you go to a bigger practice. You don't know who your labor and delivery nurse is going to be that day because you get assigned the day of who your nurse is going to be.
Yes.
And so you have somebody that has been with you throughout the course of the pregnancy, and they're a controlled person in the room. That's someone that you know is going to be there. And so right away, it's a safety mechanism. You feel safe because you've known this person throughout the course of your pregnancy. You developed a plan with her. She educated you throughout the whole course of the pregnancy. So you're walking in feeling prepared, supported, and you also know someone's going to advocate for you throughout that process. And there are things that you've spoken about already. So there shouldn't be any surprises unless baby gives you surprises. But even with that, she's there to pivot to plan B or even plan C. And a lot of the times when you're a first-time mom and you're going through this labor for the first time, you don't know what the pain's going to feel like. You don't know what the contractions are going to do to you. And you're not exactly sure how to even manipulate yourself through this room. Do I get on the ball? Do I get in the shower? And so for someone to guide you throughout the whole process and kind of make you get a little uncomfortable with trying different things, like getting in a shower, getting in a tub, or getting in hands and knees, a lot more people feel supported and have better outcomes because of that. And so doulas are hired for various reasons. There isn't just one reason, but the common ground is that they're really being hired for support and feeling safe because people hire doulas if you're having a C-section. So it's not just for having a vaginal birth or a unmedicated birth.
I'm glad you brought that up too, though, because just what I've experienced from being in this stage of pregnancy and talking to a lot of other moms or women who are trying to conceive, it does seem as though there are a lot more women who are getting C-sections. And I hear a lot of women telling me that they want a doula because they want someone to help advocate for them to have a vaginal birth if possible.
Yeah.
You worked in the hospital. what is your take on that as someone who worked in the hospital? Do you feel that there are more women who are having C-sections, and what do you think about it?
Yeah, that's a very good point. And I feel like it's also like a hot topic right now.
Yeah.
And that's why women are hiring more doulas, and you see the demand there more for doulas, because I feel like people are doing a really good job at educating themselves and not just walking in not knowing anything anymore to the hospital. Like that is something old. And even from now being in this field for 8 years, to watch the transition of the patient's mindset, it's changed completely. And so being on the other end of it and being the provider, I do see why maybe C-section rates have increased. And
well, why
I
do you
have
think
to be
that
on.
is?
I'm here to just be vocal and
Yeah.
honest. Okay, let me just rip it off like a Band-Aid. So
Yes.
there are a lot of providers that are not patient with labor. And everything is on a time schedule. And I've just seen now, when you're a doula, and I didn't have this being a midwife, you're able to go to all the hospital facilities and see the way things are done over there, and see the way that the residents work and the way that the doctors work and how things are done over there. And you're seeing that there's like a timed schedule to everything when it comes to vaginal exams, when it comes to breaking water, when it comes to how long has she been in labor for. And I don't think that C-sections are being always called appropriately, and patients don't know any better than to decline them, because as a patient, you're in the most vulnerable state. You're laying in a hospital bed. You have your babies on a monitor, and you're just putting all your trust in the healthcare team that they're going to make the right decision. And it makes it seem as if you're being selfish by saying, no, I don't want a C-section, because it should be being recommended for the safety of your baby, right? But if you had somebody that knew the back end of things and knew that it's too early, we need more time, she's not really in labor right now. You know, yeah, she's been here for a long time, but she doesn't have a good contraction pattern.
Right.
Or give it a few more hours, or we don't want the water broken right now. That doula is the secret sauce to the advocate.
I thought, just based off everything I've been hearing, that there was definitely a tie between all of that going on and the doulas. So what are your thoughts on a C-section? I have a lot of friends who have had C-sections. I totally get, and I'm not a medical expert at all, why they're needed. When do you think is the right time for them?
Yeah. So C-sections are for different reasons. There's some that are non-emergent, and that's because a baby's not in the right position, it's breech, or maybe you have something going on with your placenta and it's in front of the cervix. That would be dangerous to have a vaginal delivery. So those are done and planned. And there are people, believe it or not, that will not do it at a hospital and deliver a breech baby at the house.
Oh, wow.
With like a home birth midwife.
I'm not courageous enough for that. Yeah.
and you know, I'm all about being holistic, but that is very unsafe. And I don't recommend that at all. There's a reason why C-sections are performed for breech babies. And so that would be more of an emergent one. So an emergent one while you're in labor is if baby is having heart tone issues, or you develop an infection because your water's been broken for a long amount of time, and maybe you developed an infection from cervical exams. Or if you are not progressing and not making change because maybe baby's not in the right position. And so if these things were to happen, I do believe C-sections are necessary, because there can be bad outcomes for the baby and even for yourself. And there are, ACOG is who creates all of these laws per se as to when they are recommended and needed. But I feel like as a woman, you would feel so much more confident knowing that you tried everything to prevent that from happening. And you feel more at peace knowing that you did everything right. And even your advocate, who you trust and built a relationship, is telling you that this is the right thing to do.
We're getting into the hot topics today.
Yeah.
bound to offend somebody, but I really want to get into it. And because you have such an expertise in both of these fields, I feel like you're the perfect person to ask about these topics. After baby is born, this is something that I've been thinking about so much. Right now, there's so much talk around vaccinations. What vaccinations should you get for your baby? What's right? What's wrong? What's your take on vaccinations post-birth?
Yeah. Ooh, I knew this one was coming. So this is probably the number one question that we get here, especially when teaching the birth class. They flip to the end of the book and look at the birth plan, and they go straight to the immunization section, and they want to know, do we do it or we not do it? And the biggest thing that I can say with that is do your own research and do good research. Look at the right credible pieces of information that are out there and make that decision between you and your husband. On our standpoint, when we go to school and when we're learning about these, it's never a point where we're learning, do you give it or do you not give it? It's always you give it, and this is why, and this is the risk to it. This is why we give it. And so being trained while you're in school, and your thought process isn't, are these not good? Do I not give them? I always just was like, well, yeah, you get 3 vaccines after you deliver. You give the baby.
That's what it said in the textbook.
Right. You get the erythromycin for the eyes, you get the vitamin K injection, and then you get the hepatitis B injection. And, I worked at a hospital where the patients were just always like, okay. And even on our end, I never felt as a new nurse that I educated the clients enough about this. I never educated the patients because in school, we're just told that we just give them. So here's your paper, sign your consent, but there's no education done behind it. You don't even know, the clients don't even know why they're giving their baby this.
Right. But it feels so wrong. Like I can just imagine myself, you have this baby and then you have these experts who know so much more than you telling you that this is the right thing to do for your baby. I know myself, I would say, okay, let's do it for my baby.
Yeah.
But how can women educate themselves on vaccinations? What would be your advice to them? How can they be prepared?
Yeah. I think knowing first starting off is what are they getting after delivery? What does that vaccine schedule look like? And then understanding why each one is given. Because here's my take on it. I used to be pro-vaccines. Okay. I worked at a hospital. That's all I knew. And so I just gave it. I always believed in medicine. Now, I work in a nice health and wellness space like this where I'm having women come into the pregnancy bar that have all the information and know all the reasons why they're not giving their babies it, taught me and led me to the right resources. And now, if I were to have a second child, I wouldn't give them all the vaccines that you get at the hospital. And that's coming from a midwife that worked in a hospital setting and a labor and delivery nurse.
Are there any particular vaccinations that you would not give to a future child?
Yes, I wouldn't give the vitamin K or the Hep B.
Why?
Okay, so I would do the erythromycin, which is the eye ointment, because if baby is born through the vaginal canal, it just helps prevent infection. And it's an antibiotic, okay? It's given through the eyes, so that I'd be on board for that one. The vitamin K injection is given because babies aren't born with their clotting factor. It's an artificial way to set an activator so that they have their clotting factor after that they're born. But it does develop with time. And so if I were to have a healthy pregnancy and a healthy delivery and deliver a healthy baby, I would just look at it as, why does my baby need its clotting factor right after it's born, especially if we're not anticipating any type of surgery or any reason for baby to be bleeding. And I'd want to take the more holistic route, which is an oral vitamin K.
Oh, okay. And an oral vitamin K, how does one go about getting that?
So I actually met a holistic pediatrician in Birmingham who told me about this.
Can we shout them out?
Yes, Dr. Alex Odell.
Okay.
And he is a concierge pediatrician that does not vaccinate and gives holistic options to the vaccines. And so it's an oral vitamin K that you give to the baby, and you can give it to them while you're at the hospital or at home. And it's just a better option than doing the injection. There's not all those there's the black box label things that are on the vitamin K at the hospital.
Okay, so interesting.
Yeah.
And then you also mentioned Hep B, correct?
Yes.
Why would you pass on Hep B?
So if I was negative, why would my baby need it post-birth?
Mm-hmm.
And I guess I never thought about that.
Yeah.
And so your baby has your immunity, has your everything.
Mm-hmm.
And so if I was a negative Hep B, which I was with my first pregnancy with Mila, and I just gave my daughter the Hep B vaccine when I had her because I said yes to everything. And I never asked myself that thought process. And so if it's more so just going back to what's the level of risk? If you were Hep B positive, I would recommend maybe that mom to do the Hep B vaccine for their child. But if not, why would your baby need the hepatitis B vaccine right after birth?
To play devil's advocate as
Go
someone
for
who
it.
is genuinely learning, which is also, I'm so appreciative of you coming on here.
Yeah.
If someone is getting pissed off right now, can you at least just appreciate that Rhonda is actually saying what she thinks, because no one ever does. So as someone who's genuinely trying to learn about all of this,
Yeah.
I would also think on the flip side, well, like, what's the con, you know? Can it only help? Like, what is the downside of getting these vaccines?
Yeah. I think it's, again, going back to do your research, because research studies are done by physicians and by people that are getting their doctorates. And just from everything that I've read and just seeing the autism cases that are associated with some of these vaccines is really what made me pump the brakes. And I read great articles, pump the brakes and do more research before just saying, get it. And there's a lot of valid points out there. And so that's my take on it. I'm not saying there's one right way of doing it, but I also was educated when I had my daughter. I was already working in the field. But the difference is I didn't do any research. I didn't do any research, and a textbook is going to tell you only one-sided, which is to have it.
Well, thank you for talking about it.
Yeah.
Because like I said, to get someone who has your knowledge and expertise on a microphone to say what they genuinely think is very difficult.
I'm always very honest.
I love it. And that's
Yeah.
why people love coming to you. Okay, so you're in the space fully.
Okay.
While we're on the hot topics,
Yeah.
what are the other biggest things that you're hearing from new moms, expecting moms right now that you think it's important to educate people on?
Yes. One of the things that just rages me is the judgment in a mom community about the hot topic of breastfeeding versus bottle feeding.
Yeah. Okay. As someone who has not yet given birth, already there's just so much talk around it. I do think one of my superpowers is I'm like pretty good at not caring what people think.
I love that.
Thank you. Well, to an extent, you know, obviously I care to an extent. But for me, once again, I haven't experienced it. So this could be very different once I give birth, but it's always been like, oh, we'll just see what I'm capable of doing. But are you talking about the shaming that people
Yes.
give moms who don't breastfeed?
Yes.
Okay, tell me about it.
So just with our business being on social media, I feel like the algorithm that I attract is labor and postpartum. And I'll be scrolling and I'm like, you know what? Let me just hop in the comments section.
Always.
And sometimes I'm just appalled by what's in there with the judgment of moms and saying that if you don't breastfeed your baby, you're a bad mother. And I'm just
projection.
like, who comes up with these things? Because what we tell moms, and specifically me, when you have a baby, a fed baby is what's best. And there's always more to it. You know, a lot of people, it simply is maybe they don't have the right resources and that's why they're not successful with breastfeeding. But mental health plays a big role into it. A mom's not sleeping and just being sleep deprived and having to wake up every few hours, and they're the only ones being able to do the feeds, and husband can't help because they're not using a bottle. And sometimes people have a low milk supply, and sometimes babies are super colicky and don't respond well to the mom's breast milk. And so there's so many different reasons as to why you might be unsuccessful with breastfeeding. But instantly, when you are postpartum, you are going to struggle with it and you are going to shame yourself because that's what society has told us to do. You failed at something, you're not good at it, and now you failed your baby. And that is so wrong. I breastfed my daughter for 12 weeks and struggled to even get to those 12 weeks because everything was going wrong with me. She had bad colic. She had acid reflux. I wasn't sleeping. She'd be up the whole entire night having a party. And on top of it, I was still in school. I was trying to get through those last few months of graduating. And so much stress, and there were so many factors that played into it. But I was afraid what everybody was going to say because I worked in that space. I was supposed to be good at it. I was supposed to be a successful breastfeeder because I'm a midwife. Why wouldn't I be? That's what I'm supposed to be good at. And I remember to the point where I was even faking at work, going to the breast pumping room because I didn't want anyone to know that I wasn't breastfeeding. Because all my other coworkers were just bragging about their milk and how much they collected and
wait, that makes me want to cry. So you just would pretend to go pump?
Yeah. And even to the point of really getting into the role of like splashing some on my scrub top to make it seem like I leaked.
I'm sorry. But I could see it though, because I think that there is, and now that you mention it, this feeling of like, oh, I'm a woman, my body should be performing, I should be doing this. For women who are struggling to breastfeed and it's not working out for them, what's your top piece of advice?
Give yourself grace and tell yourself that you're doing a great job because your mental health is not in the best space after obviously having a baby. And I feel like even just words of affirmations and not getting too many people's opinions and just being true to yourself is the best thing that you can do. Now, if a mom really wants to breastfeed and she wants to try to make it work, the great news is that there's so many resources out there. With lactation services, they're coming straight to the house, to you. You don't even have to worry about bringing the baby out. And you will rarely run into a single insurance company that doesn't 100% cover it.
Really?
Yes, and even covers them coming to the house, fully covered, 100%. Yes.
Oh, that's a pro tip. Thank you.
And people don't even know that they get 6 of these sessions included.
No, I had no idea.
Now you know, and you're going to utilize them.
Yes, I will. Thank you.
And a lot of times people don't even know the other things, like you have to have the correct flange size. Maybe that's what, like to your breast pump, maybe that's why it's not working for you. And you have to, there's different ways to hold your baby while you're breastfeeding. Maybe you're not successful because baby's not latching in the position that you're putting them in. This is the best way to explain it, is that you and your baby are, it's like riding a bike. You're trying something new for the first time, and it doesn't involve one party. It's a 2-party thing that you guys are doing together, and you guys are both figuring it out for the first time. And so a lot of times it just takes patience and time. And so working with a consultant is a great tip. Working with a nutritionist is another great tip, because there are certain nutritionists that help with your breast milk quantity and quality. And that's also covered by insurance.
Amazing.
Yes. And then even coming to a place like this, we have even like a lactation drip that helps with your milk supply. Yes.
How does that work? What's in the lactation drip?
Yeah. So a lot of it is simply because of dehydration. So that fluids is what's going to help as well.
Okay.
There's magnesium in there. There's B complex, which has all your B vitamins, B12, and then zinc. And all of those have proven to support your milk supply.
I'm a big fan of these IVs. I'm very excited now that I know about this.
We're definitely going to be giving you one.
Thank you.
Yeah.
Okay, I want to get into, towards the end of this, just tips for moms. And are you comfortable too talking about trying to conceive?
Yeah.
Okay, let's start there. We're just going to do a whole round of tips. For women right now who are trying to conceive, what are 2 tips for them?
I would say to start off by really evaluating your lifestyle, seeing what are you doing that is maybe causing stress in your life, or maybe some habits that you're doing. Maybe you're a smoker, or maybe you go in the sauna too much, and really looking at everything in general to see how can I fix my lifestyle first and make healthy choices. And then I would make sure that I'm efficiently trying to conceive. Now, what I mean by that is that I'm checking my ovulation. I'm using sticks.
Oh, yeah. Mm-hmm.
And then I'm being sexually active on my days that I'm ovulating. Because we would have patients come to the OB office and they've been saying, I've been trying to conceive for a year and I'm not pregnant yet. And I have to peel it back a little and say, define what it means by you've been trying to conceive. Because trying to conceive, people just thought, oh, you know, I'm just sexually active for a year.
Right.
But if you're not on the days that you're ovulating, that's not trying to conceive.
Okay, I actually have a hot topic. I'm glad you brought this up.
Ooh.
I would love to get your take on this.
Okay, tell me.
There's a theory on the internet right now.
Okay.
It seems like all the moms this year, most recent years, are having boys. And there is a theory online that the reason that there are so many boys right now is because women are tracking their cycle and they're having intercourse on their ovulation day. And that's causing more boy sperm to get through because it's quicker and it's right on your ovulation day. Have you heard this, and what are your thoughts on it?
I have not heard this specifically, but I have heard about the Chinese calendar.
Oh.
Yes.
Okay.
And that playing a role. And I've heard something similar into what days of the month that you ovulate on.
Yeah, like I have heard that if you have intercourse earlier in your cycle, you're more likely to have a girl because the girl sperm lasts longer. And that's where the whole theory comes in that so many women are having intercourse on their ovulation day, and that's why they're having so many boys. What do you just think about the science behind that?
I mean, I think that is possible. Listen, I will tell you one thing. In the 8 years that I've been working in labor and delivery, you go to the unit, you're seeing 90% of one gender. It comes in waves. You're either seeing all girls that are being delivered or it's all boys.
Okay, and you think that kind of relates to the Chinese calendar?
Yes, absolutely.
Okay, interesting.
It's not an odd coincidence. And then how about I have people coming in here and the whole day, if everybody's kind of doing 3D ultrasounds and everyone's 28 weeks, they're all pregnant with the same gender.
I'm telling you, because right now it seems like everyone's having boys.
You didn't tell me what you're having. And have you announced to the internet and the world?
Yes.
Okay. I'm going to guess and tell you what you're having.
Okay.
I think you're having a girl.
No.
No?
Isn't that crazy? And I am so shocked. I actually haven't really talked about this. Everyone thought I was having a girl.
You scream girl. You're the person that ends up ruining it for me. There's always, out of 10 people, I guess, 9 I'm right about. And then there's one that's like an outlier.
I swear I just wear a lot of pink or something. Everyone thought I was having a girl. I actually sometimes think, well, I won't get too off topic. Sometimes I think I'm a little psychic because I weirdly know things sometimes right before they happen. Like I can honestly hear Connor laughing in the background, but I knew I was pregnant before it was possible for me to know. And it was very random. Like I was just laying in bed and I just had a premonition. I was like, oh, I'm pregnant.
And nothing, no sore breast, nothing.
No. It was like way too early for any of that. Like you couldn't have tested or anything.
It was like the day after.
I literally was laying in bed and I just got this. It's happened with a couple things. Anyways, it happened. I was like, oh, I'm having a girl. And I was positive.
Yeah.
It's a boy. Even when we did my anatomy.
Do we need to confirm on your another ultrasound?
When we did my anatomy, I said, can you double check it's a boy? And yeah, he was right there. It was a boy.
Okay. Well, back to your theory. Yes. I don't think you're wrong. I think that there could be some science behind that. And I bet that there's research out there. I bet there is.
I just wanted your take. Okay, so we're moving on. We talked about those who are trying to conceive. For women who are fighting nausea, their first trimester, all those symptoms, your top 2 tips for them.
Yes. B6 and Unisom is what I'm going to tell them to do at first. B6 is going to fight the nausea, and the Unisom also does as well. It's like a cousin to Benadryl. You take it at night right before you go to bed, but it only works if you take it appropriately. And this is the number one mistake that I see. People aren't taking it appropriately. The B6 has to be taken 3 times a day. Breakfast, lunch, and dinner. Most pregnant people aren't eating breakfast, lunch, and dinner, but 3 times a day. And then in the evening, you have to take the Unisom. You are creating a pill by doing that. So a pill called Diclegis is kind of a cousin of that. It's the same. And so a lot of people don't take it appropriately, and that's why it doesn't end up working for them.
Those were the two that I took when my nausea got really bad, and they helped me a lot.
Yes.
I still had it, could have used an IV drip.
Yeah.
Now I know for another time, but those helped me a ton.
And even if you are in another state and there's not a pregnancy bar there yet, I do recommend even getting like just a hydration IV.
So smart.
Like just fluids.
I'm totally doing that in the future.
Those are my top 2 tips.
For women who are pregnant and they're really struggling with hip and back pain, what are your top tips for combating that?
Yeah. My 2 top tips. I always like to say start with the least amount of intervention and something that's just natural and holistic that you can do. I always start there. So start with wearing a back brace.
For
like
the
a pregnancy
back pain?
belt.
Okay.
Yeah, like a pregnancy belt. And so I love the Mom Cozy one. It's a strap at the bottom, a strap at the top, and it helps lift up the belly. And then it helps with the pelvic pain and the back pain. It also helps with your posture. And then if you're doing that every day, it's not working, I recommend seeing a chiropractor in pregnancy.
Okay.
But they have to be Webster certified. That means that they did extra schooling to specifically work on moms and babies.
Okay.
If they're Webster certified, I'm not for it.
I love that. Thank you. For women who are pregnant and they're struggling with sleeping through the night, what are your top sleeping tips?
Yes. Magnesium, magnesium, magnesium.
I've got to get on the magnesium. I don't know how I'm this far in my pregnancy and I haven't. What's the right magnesium? Just walk us to the water. What do we need to do?
Yes, because there's different kinds.
Yes.
I like magnesium oxide.
Okay.
Yes.
Can I get that on Amazon?
Yeah.
How do I get that?
500 milligrams.
Okay.
Any of them. I like the one by Parallel Health.
Wonderful. Okay.
Yes. And I just love all their pregnancy things, honestly. It's a great brand. That and Ritual, they both have really great supplements. But it also doesn't have to be anything expensive. What you really want to look at is how many milligrams am I taking? Am I taking enough? The recommendation in pregnancy is 500 milligrams once a day. Take it right before you go to bed.
Okay. For women who are preparing for labor, what are your top 3 tips for preparing for labor?
Yes. Take a birth education class. Do not go in just blind. So even if you take one online that you take at home, take some sort of class. Have a birth plan. Don't have it be too specific. Use it as a communication tool that you're able to kind of let the staff know about where your mindset is with things. It's more so your birth plan should have a theme. I'm holistic, but I also believe in intervention if it's needed, for example.
It's me. Perfect. Yeah.
And then here's my next one.
Okay.
Don't bring family to your delivery room.
Why?
I am not on board with having too many people in the delivery room.
Okay, why?
My reason being is that I always feel like people really don't get to enjoy the intimacy that carries throughout the delivery room with you and your spouse. And it's like the too many cooks in the kitchen. I always see issues with family and telling their daughters to like get the epidural, they're in pain. And with girls that are wanting to have more of like a holistic natural birth. And then always I see like little arguments between the family and the nurse or the doctor. And so it's like extra chaos.
Arguing. I feel like I couldn't handle that.
Yeah.
Okay. Packing the hospital bag. What are the top 3 things that you think need to be in a pregnant woman's hospital bag?
Oh, this is a good one. I love when people pack their own hospital gown. I feel like
yes.
Yeah,
I'm like excited to pick it out.
Yes. Bring your own hospital gown. You are going to love it later because even the material on the hospital ones, they're so uncomfortable. And so having something that is just like very soft and like comfortable, buttery, it feels so much nicer. And I feel like you're almost able to like feel like you're less in a hospital.
Yeah, absolutely.
Yeah. So hospital gown and then cozy socks.
Okay.
And then a really cute outfit for baby to take pictures in after it's born.
I love that.
Yeah. Never take too many things to the hospital with you. And I'll tell you why. A lot of times people come back home.
Suitcase.
Don't do it.
I was going to pack
do it.
like everything. Yeah.
I actually have a guide and I'm going to be adding it to the website. Okay. People can access it for free. It has all the things to take with you to the hospital because so many things they have it there. And there's no point in taking all these things and then having to bring them home and unpack them. And so I say, take the least that you need to. Don't worry about when you come home about having to unpack anything. And then you don't have to get like your stuff dirty at the hospital or anything because there's everything there. There's baby combs, there's baby shampoo, baby diapers, postpartum
I was gonna pack
underwears.
it all.
No.
Okay.
Don't take your stuff there because honestly, I like the hospital underwears and the hospital panty liners.
Really?
Yeah. I would send
and
them
they're
home.
free, right?
Free.
Okay.
And yeah, you tell your nurse, pack me some to go.
Oh, perfect.
Yeah.
Okay. You talked about having a birth plan. Obviously, like you can't always have things the way that you want, but it's nice to have a goal.
Yeah.
How do you go about making a birth plan? Lately, I've been seeing on my algorithm, people have tea lights, they have like star lights, the lights off. How do I even go about learning about that and preparing for that?
Yeah. So I have a template that I use here at the pregnancy bar.
Okay.
And I think maybe we should do something fun for everyone that's listening and offer like a free PDF for them to be able to access.
I love that.
Yeah. And so the way that I have my specific birth plan, and even if someone wants to make one of their own, is I really start with like the environment. And like, do you want tea light candles in there? Do you want aromatherapy to help in the beginning of your labor or even have it throughout the course? Do you have a specific playlist of music that you want to play? And then sometimes people forget those things. So like even as a nurse, I would be like, I noticed that you said you wanted aromatherapy. Did you bring it with you? Or we have some here at the hospital. And a lot of patients don't know that. And so do you like the lights turned off in your room? Do you not want it too bright? Do you not want students in the room? Do you not want any medical students or any nursing students in your room? Do you want like low voices in the room, for example? So it's like a way of being able to tell your nurse what kind of environment you want them to set in the room for you. If you're not going to be vaccinating baby, or if you are, that's a great thing to be able to put on there. If there's certain position changes that you know that you did your research on that you really want to be able to utilize during birth, that's great to have on there. If there's position changes that are super important for you to have even when you're pushing, that's great to have on there. And so, because in the moment when you're pushing and you're in pain, sometimes you forget to do these things. And so it's really nice to have that so that way your nurse can kind of enforce it. That's what they're there to do, either them or your doula.
Okay.
And then we have stuff like, for example, like I have on there, please like wash your hands before touching my baby. Just little things that you might feel uncomfortable saying, but it's on there.
This is all on your PDF?
It's all on my PDF.
And how do we access this?
I'm going to give it to you.
Okay.
And then maybe how about
put it in like the show notes?
Sure.
Okay.
And then maybe I can even add it on our website.
Amazing. Okay. So it'll be in the show notes. So if you're listening right now, go to the show notes. You can click on it there and also go to the pregnancy bar. There's a million things to check out there.
Yeah.
Oh my gosh. I just feel like I could talk to you forever about all these topics.
This is so much fun.
I know.
And I'm really excited. What I'm going to do, and I wanted to wait till now to tell you, is the Northville location is our second location.
Yes. Okay. Opening up now.
Yes. Opening up in 2 weeks, but I'm inviting you in over there to have like a little spa day. And we're going to have you try out an IV. You're going to get an ultrasound. You're going to get a prenatal massage.
And that's so sweet. And we'll document all of it.
Yeah. And
we'll put it on social media.
We'll be able to have you experience it.
Oh my gosh, Rhonda, thank you.
You're welcome.
You are just so in your element here.
Yes.
Like watching you light up when I ask these questions and advocating for women, I'm just so happy for you that you found this.
Yeah, I'm really, I never would have envisioned that I'd own something like this and that we're growing and, you know, just to see all the milestones we've hit. How about this? We've recently trademarked and got accepted for our trademark. Like,
oh my gosh, congratulations.
Huge milestone.
Yeah.
And I already picked where location number 3 is going.
No way.
Yeah.
Which I'm sure is a big secret.
It is.
But that's fine.
But it's not in Michigan.
It's not?
No.
Oh my gosh, I'm excited.
Yeah.
Okay.
And so just to watch all of these things kind of unfold. And when you have these crazy dreams and goals, you know, you always wonder, like, will they really happen? And I'm just watching them all unfold right in front of me, and they're happening. And so we've created something really special over here, and I can't wait to see where we end up, even in 5 years from now.
I'm so excited for you guys.
Yeah, thank you.
Okay, last question for this episode.
Okay.
And already I'm like, I want to have you back on after baby to talk even more.
Yes.
We've talked for so long, but we're gonna do a whole nother episode.
Okay.
If you're up for it, if you'll come back on for
Always.
newborns.
I love this.
The last question of this episode. So the name of the show is Water Your Garden.
Okay.
And the precipice is that every episode is a chance to pour into yourself, to water your own garden. So what do you do? I know you work like crazy. You have all these businesses, all these women that you pour into. what do you do to pour into yourself so that you're able to perform at this level?
So I always like working out is a non-negotiable for me. Like that's,
What kind of workout?
I do Pilates.
Love.
And then I also do a little bit of strength training, but I love going to classes. There's a place over here around the area called 444 Pilates.
I wondered if you went to 444.
Yes, I'm a 444
okay.
girl, but I love the owner, Ashley. And so for me, like that's like, it's more than a workout. It's like a mental health thing for me.
Absolutely.
It definitely starts my day. So I go there a few times a week, and then I have people that actually fill my cup up. And that is my daughter, Mila.
Oh.
She gives me all my purpose in my life and my business. She is the most important thing to me. And so she really is my motivation throughout the whole week. And any downtime that I get with her in the evening is what really recharges me for the next day. And then I'm super close to my sister. Me and her have an amazing relationship. And she's like my therapist right now. I call her for all the business problems, situations, and she's such a good listener. She really does listen to me and gets me through my week as well. And then my significant other. And so he really is my therapist. He helps with the business and team building over here. He always is just doing fun things for me, and he always will like make me take enough time for myself in the evening as well and make sure that my cup is filled. So I'm really lucky to have people that really fill my cup up and are always just caring for me. And because that's what I do for everybody else. So
yeah, so you need that in yourself.
Yeah.
I do want to mention briefly too, just because I swear we'll wrap this episode up. Another really powerhouse woman that I admire, I was talking to her this week, and I was just saying, you know, one of the things about becoming a mom that I'm really nervous for is losing my identity. And I have always been really driven, and I love to work hard. And already I think, how am I going to juggle the podcast, like work, family life? How am I going to juggle all these things and be the mom that I want to be?
Yeah.
And some advice that I got recently was that when you really have those dreams and ambitions, this woman told me that when she gave birth, she actually felt a spurt of energy, and she felt even more ambition to go after these dreams for her children. And it sounds like that's a little bit similar with you and your daughter.
Yeah. So it was not like that when I had her.
Oh, okay.
Yeah. It was not like that when I had her. And I feel like a lot of that came after because I struggled a lot postpartum with her. And I think like who your significant other is plays a huge role in that postpartum journey, because a lot of times the best support comes from them, and even giving you time to go take a shower or go run an errand or go get your nails done, and just remembering that you're human too, and that everything doesn't just fall on you. So now if I were to have any more children, I could just relate to what your friend told you, and I can definitely see that happening this time around.
It's important perspective.
Yeah.
Rhonda, thank you so much for coming on the show.
Thank you for having me.
This has been so much fun. Like I said, we have so much more to talk about.
Yeah.
You guys send this episode to someone you know who is trying to conceive, who is in their pregnancy journey, who just gave birth, who is maybe thinking about expanding their family. Go check out the pregnancy bar. And of course, we're going to have Rhonda back on because there's like too much to talk about. So if you have questions or topics that we didn't cover, or you wish that we had talked about more, leave that in the comments or DM us on social media. But as always, thank you so much for joining us, and thank you for watering your garden with us.